Good morning. I'm Dr. Chong. I'm the cardiac surgeon working in KPJ Ipoh Specialist Hospital. I've been here since 5 years ago. Most of my work involves patients who need bypass surgery, what we call coronary artery bypass surgery. It's done in patients who have arteries blocked in their heart. This usually happens to patients who have diabetes, high blood pressure, high cholesterol, or because of a family history of heart problems. Many cases also is because due to smoking. When this happens, the patients usually experience chest pain when they walk, when they climb upstairs, and sometimes when it's bad, when they get a heart attack, they'll feel short of breath, sweaty, pale, and sometimes dizzy or even collapse. In cases like that, we need to see if the patients had arteries blocked. Usually they will be checked by the cardiologist first. If the cardiologist do the ECG, stress test using the treadmill, echocardiogram, and coronary angiogram. If the coronary angiogram shows that one of the arteries is blocked, usually this can be done by using balloon angioplasty and stenting. However, if the vessels, all three of them are blocked, or the left main stem is blocked, then patients like this will be referred for bypass surgery. Because bypass surgery in these cases, first is safer and then they last longer. And balloon angioplasty in cases like this, the risk is higher. This is why even very important people like presidents or prime ministers would have to go for bypass surgery. If you have to go for bypass surgery, you come into a hospital and then we would assess you and prepare you for the operating theater. We have to take the vein from your legs, the artery from your arm, and another artery from behind the breastbone, what we call the left internal mammary artery. We use the veins and the arteries to bypass the arteries of your heart which was blocked by connecting from the aorta to the heart. This is why it's called the coronary artery bypass surgery. One thing that nowadays we emphasize to the patient is that the bypass surgery is very safe. If it's an elective operation, that means if the patient did not have a heart attack before the surgery, the risk is very low at about 1%. That means 99% of the cases, the operation will be successful and you'll be home in a week's time. But if you had a bypass, if you had a heart attack, let's say if you collapse at home due to sudden closure of the artery being blocked, and then the risk will go up very high to 10, 20% or even 50%. So the advice now we give to patients, if you experience any symptoms or if you are not sure about yourself, you can come for a checkup. Then we can arrange for the operation to be done as an elective case. Then the risk will be low and it's 99% of the time you'll be home. And after the operations, you recover in 2 to 3 months' time. And if you look after yourself and take your medications, most of these patients can expect to live 10 years, 20 years, or even up to 30 years later. For people who are worried about getting heart problems, the main thing is to look after themselves since very young age. If you can exercise regularly, 5 times a week, mainly like jogging, cycling, or swimming, and up to half an hour, 1 hour each time. The other thing is to avoid having any stress situation at home or at work. Sleep early and get enough sleep every day. Look after your diet. Try not to have any high cholesterol food like crab, shellfish, and egg yolk and things like that. Try to cut down on the amount of cholesterol you take in, and look after your blood pressure, your diabetes, and most important of all, if you can avoid smoking altogether. This is what our heart looks like. It's a bit smaller than normal. It sits like that inside our chest, facing forward. Our heart have 3 arteries, one in front, one on the right and one at the back. Almost everybody got 3 major arteries of the heart. Yeah, some of them have 2, some of them have 4, but we can just assume everybody has 3 arteries of the heart. When there's a block here, and a block at the back, we would say the patient will need a triple bypass. What we do bypass is we take the vein from the leg and join from the top, the aorta here, to below the narrowing there. This is what you call a bypass surgery, from here to here, from here to here, and from here to the back. This is what essentially a bypass is about. Inside our heart, we had 4 heart valves. Yeah, heart are divided into right and left heart. Okay, left side and right side. And in order for the heart to pump the blood in one way, each side has an inlet and outlet valve. The left side of the heart pumps blood to the head and the whole body, and the right side of the heart pumps the blood to the lungs only. Because the left side of the heart has to do more work, the heart valve tend to get damaged. There's the mitral valve and the aortic valve. If the valve get narrowed and blocked, it can prevent the blood flowing smoothly. Sometimes the valve also can be damaged and leak. So when the heart pumps, the blood, instead of going forward, it will be going backwards. And the patient will experience symptoms like shortness of breath. When cases like that happen, sometimes the heart valve can be repaired. But when it cannot be repaired, we have to replace the valve using either what we call a mechanical valve, which is made of titanium and carbon, or a biological valve, usually made of the pericardium, which is the sac of the heart. This is what we call a biological valve. The mechanical valve is usually used for younger people because it can last longer. But however, you need to take anticoagulation, which is the blood thinning medicine, to prevent the blood clogging up the valve. For this one, the biological valve, it's safer in the way that you do not have to take the blood thinning medicine, but it doesn't last as long. It lasts for about 10 to 15 years. This is used in the people who are 65 years or 70 years of age. The valve can be damaged either due to wear and tear. In elderly people, the valve can get calcified. The calcium can deposit in the valve just like it deposits in our arteries. The valve can become stiff and jammed. That's why when the valve is calcified, you block the blood flow. But sometimes the valve also can tear. It can rupture and it will leak. Then the blood would leak backwards. And sometimes due to infections or other causes. The symptoms of a diseased valve is sometimes the patient, most of the time the patient would feel short of breath. But sometimes they will get palpitations and sometimes they can get chest pain. The valve replacement operation is a very big operation, just like the heart bypass surgery. Because you have to stop your heart, take away the old valve that's not working and put it in. The operation itself is quite straightforward, but a lot of the time it's because the patient comes very late when the heart is already very much swollen and failing, and the other organs are damaged. In these cases, the risk can be higher. So if the valve needs replacement, the patient should not wait until it's too late. If your heart is still functioning very well before the operation, most patients can expect to lead quite a normal life. However, if they are on blood thinning medicine like warfarin, it's advisable not to have any contact sports or very strenuous exercise, so they can sustain any internal bleeding easily due to the anticoagulation. But if they have a tissue valve in an elderly person, they can lead a relatively normal life. Of course, they have to be careful.